Jackie Juarez, welcome to the podcast.
Hi.
I've been looking forward to this.
Same. Very
Uh,
excited.
so you and I go way back. It's
Yes,
been,
we
I
do.
don't know, almost 25 years.
25 years.
Kind of insane, right? I
I
read
know.
something at a store. It was a local store here. It was on the wall, said, good friends are like free therapists. And I never thought that our
Yes.
relationship, more so than any other relationship I have, is that rings more true than
Oh,
it ever possibly could, right? Uh,
100%.
I would say that probably our friendship, more than any friendship that I have, and I have quite a few long-term friendships, has been challenged in ways that I've learned more from our friendship than I have probably any other. As far as
Absolutely.
what a friendship should look like over the course of
Hmm.
time,
Hmm.
and the challenges that a friendship can face, but can
Hmm.
endure.
Hmm.
Um, you probably more than anybody experienced anybody that is currently in my life has seen the ups and downs of my life. You've seen me at my best, and you've seen me definitely at my worst
Yeah.
in a way that no one else has.
Yeah,
So
absolutely.
I just want to take this opportunity to publicly thank you for our friendship.
Oh, well, thank you. It's truly like I say this with just the most sincerity and the biggest amount of love that I truly cherish our friendship so much. It's one of the longest, most worthwhile endurance. It feels like it's felt like a marathon of endurance teaching me things that I didn't know I needed to learn in ways that I didn't know that I was going to learn them.
Yep.
And just like, and I say this with just true sincerity, like I've loved watching you grow, and I've also really loved the painful moments. Even like I can say that now, like the really
Yeah.
painful moments have taught me so much about like the hero's arc and the way that a person can just, you think you know them and then you see them go through something so intense and it's like wow, that is true character building. And I mean, I like I've told you before, I've just been in total awe of the things you've experienced and gone through and then taught me and taught yourself and rebuilt. And I mean, I adore you. So this is truly, I reciprocate that. Thank you, because it's one of the best friendships I've ever had.
Awesome. So let's talk about psychology for a minute.
Yeah.
How did you end up on this path, ultimately in psychology, but
Yeah.
ultimately where you are now as
Hmm.
a social worker, right?
Yeah. So I started out, I always knew I wanted to be in the helping profession from the time I remember being my earliest memories, like at 4 years old and 5 years old. And I remember saying to my parents, I want to be a doctor. I want to be a
Hmm.
doctor. And I would see them on TV and they always seemed like they had like the best jobs. They were helping people and people would look up to them. And so there was this like really interesting relationship that always, and medicine and science has always been very intriguing to me. Um, and then growing up, I thought medicine, I'm going to be a pediatrician. I love kids, love working with kids. Um, but then in my personal life, didn't realize until much later, I was kind of acting as like a referee in my house, whether it was like between my parents or refereeing an argument with my sisters and my parents or translating what somebody said. They didn't really say that, they said this. And it was these like weird interactions that would happen over my lifetime that really transformed medicine into, I do want to help people, but I want to help them from the perspective of understanding one another and help. And I want to understand people better. And so I went to UT in my freshman year. I went into biology pre med thinking, this is it. This is great school. This is where I want to be. And then I just had a total identity crisis. I
Hmm.
realized I'm different. Something about me is different. I'm not, I don't think that I'm straight. I think that I'm bi. I don't really know. And that was happening while I was far away from home and my family's very close. And there was a lot of, fear of judgment. And so thinking, okay, I'm safe where I am. But then I went started like really, I was a good student and I was taking some classes that were really challenging to me. And we went and watched an open heart surgery. And I remember standing above this pit of doctors cracking somebody's chest open
Yeah.
and and a heart in someone's hands. And I thought, oh my gosh, I don't think I can do that.
Yeah.
And I got my first whiff of what formaldehyde smelled like. And I was like, okay, nope, that's not it.
Yeah.
So with that, with all of these, like, then it felt like a crisis of identity in forms of education and what I was going to do. I didn't want to waste my parents' money. I also
Mm.
just didn't know what I was going to do. And so I thought, I'm going to go back to Houston and go to University of Houston, regroup and figure it out. And then I went back to University of Houston, and within a year, I took a developmental psychology course, and I just fell in love with it. I was like, this is how I want to help people. It was totally intriguing to me to understand stages of development, what the way that our parents and our families influence us, and then how that influences the way we think about the world and the way that, brain chemistry works and all these things. I was so intrigued. Then I took another psychology class the second semester. I think it was behavioral a behavioral class that had to do with like understanding things like psychopathology and what did it mean, the nature of a sociopath and all these things. And so it was like, ooh, this is really interesting. We're really digging into the where how people develop personality and how that's expressed. And I was hooked. I fell in love with the psychology program at U of H. My dad's a U of H alumni, and I just started meeting people that were also different like me, that just took me in and were like great people and fun and funny. And I loved Houston. I'm from there, from the Baytown area. And so it was just like everything started to fall in place. And I felt like, okay, I'm figuring out the educational journey. I'll figure out the other stuff along the way. I've always been very high achiever type person where I needed to know what I was going to do. I couldn't flounder and be like, I'll figure it out. Like a fine arts degree was not in my, not in my purview. So once I got that, things just really started to fall in place. And then I started getting into being research assistant, and I really loved like the data, understanding data. I wanted numbers. I wanted information. I didn't want to just have the theory. I wanted to have the data behind it so that it really could make sense to me and I could put it all together. So I started on that path, and then I started making other friends, and then I met you at the end of that.
I had never conceived that our friendship came out of a crisis like that. We would have
Mm-hmm.
never met had you not had
Mm-mm.
that crisis.
Mm-mm.
That's
Totally.
incredible to
Is
consider,
it
really.
crazy? I
Yeah.
know, I know. It's so wild because friends that I made during that time period, um, that were also just very similar to me and what they were going through, I'm still friends with,
Yeah.
and it's crazy. It's just crazy to know people for that long and really truly like watch each other grow and change and blossom into who we've become. And so, yeah, so psychology was the path I found. And then when I got to the end of my bachelor's, I had started working for a research group on campus at University of Houston. And we were doing a lot of educational research. And I really liked it. And I really liked running projects and data collection and then learning how to analyze those numbers. But I didn't know if I wanted to do something in the statistical analysis realm, as a master's program. And so for me, I spent many years trying to figure out what that was going to look like, and also finding myself, really just like coming out and then dealing with what that did with my family and, traveling and all these things. And then I knew though, because I wasn't completely happy in my field, that I needed to work with people, like direct care type thing, and started looking at graduate programs. And somebody said to me, because I had taken an intro to social work program, intro to social work class, and I really liked the idea of getting involved to help people at a macro and micro level. And I really liked the idea of the micro level, meaning not just changing a system, but helping a person operate within a system and figuring out how to do that to the best of their ability. So I started researching schools and looking at Masters of Social Work programs. And then I thought about counseling. And I found when I was doing that research that social workers could become counselors and that they could be reimbursed by insurance and could have private practices. And then it really just came, it was like an aha moment. And I thought, this is what I want to do. So I followed that path and led me to New York, to NYU. And I went to NYU to their clinical social work program. And, it was just the perfect fit. Like it was every single thing that I loved. It was theory, understanding the theory. There was data that could give me real, true facts as to why certain things do happen and exist. I was helping people, I was learning how to help people. I was going to be able to grow clinically in a way that I've really wanted to do, and it just everything lined up. It's funny because I tell my wife Jen, like, I know that I'm when I'm making a right decision, because when I'm not, I feel like a universal pushback. Like I start to try to fit something into a narrative of what I think it should be, and then it's like a roadblock will happen, and then another roadblock will happen, and it just feels like, if something is going to work out, does it need to be this hard? Do I need to really make it this hard, or am I making it this hard? And then when I made decisions that I'm like, yeah, I think I'm going to follow this path, and things just start to kind of fall in line, it begins to kind of be very clear this is the right direction. And that's really what happened when I went to social work school. It was like, this is it. This is what I need to do. And I have worked in all areas of social work. It's been wild, from little bitty kids, doing play therapy, doing helping with housing, helping the chronically homeless, severely and persistently mentally ill, to working with the elderly in the nursing home setting, helping them die, helping them have an honorable death, orchestrating that with them, and being on that end of the spectrum. So it's given me a breadth of experience across the lifespan. And I've ultimately landed in individual counseling. I do primarily individual, family, and couples counseling. I don't really do a ton of family counseling anymore, but that was what I was trained in, when I got out of my master's program.
What do you think we're missing about the world of psychology and the psychology
Mm-hmm.
of Americans right now?
I think that we're missing an opportunity to help people de-identify from the thing that their diagnosis. I think we've created a culture, unfortunately, where, and we talk about this. I work in HIV services. We talk about when somebody's diagnosed with HIV, they can start using language like my HIV, I am HIV. So they talk about themselves as a disease. And I've really, that's really helped me to formulate a really good understanding of the way that I think a lot of people see their mental health issues. They see it as an identity. I am depressed. I am depression. I am anxiety. I am trauma, right? And so if you identify as that, then it becomes just a part of you, and it's not something that you can learn to either overcome, learn to live with, learn to cope with. It becomes a blanket way of seeing the world. And so then we don't teach resilience. We use it. People say it all the time. I hear it all the time. I'm resilient. And but then you kind of dig in, like, what does that mean? And they can't really put it into words because they don't know what that looks like in their life. And so I think we're missing opportunities to create deeper conversations about how to live with something versus how to identify as something. And then how to also not have to be that all the time,
Yep.
and to learn to become a healthier version of that.
What's interesting to me about this is we've known for a really long time dangers of identifying your illness, whether it's a physical illness or a mental illness. We've known
Mm-hmm.
for a long time, but it seems like now more than ever, people
Mm-hmm.
are latching onto labels to describe themselves. Why do you think
Yes.
that's happening?
I think sometimes as a society, we become very interested in the workarounds, and we want things that are quick, and we don't necessarily value prioritizing our own self-care not in the sense of like a hokey type, I need a nap, I need a bubble bath, but really like wellness and mind body connection. We disconnect the mind and the emotions from the body so much that it's easier to say identify as this versus trying to figure out how is it impacting me, what can I do to live with this, how can I manage this versus it's managing me and it's actually ruling my life. And so I think that a lot of times, and I don't know that this is true for everyone, but I've witnessed it in some environments where individual counselors can do more harm because they are potentially, if they lose that client, they lose their fee for service, they lose that pay. And so there are some people that are motivated to keep people sick. And I think that, that's unfortunately an issue that people don't really necessarily want to talk about because it
Yeah.
can become something that um, is very stigmatizing for the mental health profession, right?
Yeah.
And so I think there's a difficulty in truly disconnecting from a label. I think the label sometimes becomes a shield. It's like, well, if I'm this, then I don't have to do this hard thing. If I'm
Oh,
anxious,
interesting.
I don't have to go and I don't have to take the train because I'm too anxious and being on trains makes me anxious. So then I have to do everything to avoid the train because the train's the problem. It's like, yeah, but we know scientifically, we know the most effective way to deal with anxiety disorders is exposure. I mean, you have to expose yourself to the thing you're anxious about
Yeah.
in order to learn how to cope, learn how to breathe, to learn how to calm yourself down, uh, so that when you're faced with that, it isn't paralyzing.
So it sounds like there's possibilities out there that people are identifying with the label as first and foremost, it gets them out of certain things
Oh
that are
yeah.
challenging.
Hmm.
It could be as simple as when I claim that I'm anxious, then I don't have to do the chores today at
That's
home,
right.
right? If I'm a
That's right.
teenager, right? I'm telling mom I'm anxious, and I immediately get out of having to do something that I don't particularly want to do.
That's right.
And that starts a cascade of reinforcement,
Hmm.
whether it be getting out of something that you don't want to do or getting special attention for having a
Yes.
particular label. Seems to be happening a lot with
Yes.
teenagers, with teenage girls
Uh-huh.
right now in particular. Can you speak on
Yes.
that and anything you've noticed in that regard?
Yeah, I do think I think that because certain mental health diagnoses are so pervasive, for example, anxiety. I mean, in reality, we all have anxieties, whether it's, I mean, we're animals and creatures that anxiety is actually built into our system as a survival tactic.
It's in the name
You
of
know,
the podcast, Nervous
yeah,
Apes, right? That's what we
exactly.
are.
I know. I love it. I love that name, by the way. But it's true. And so I think that we have, unfortunately, continued to validate that and say, well, if mom is anxious and then has a daughter that's anxious, well, mom now has like can over sympathize with anxious daughter and continues to perpetuate the same illness that she has upon her child. And it's now an excuse to not have to do anything because it's being reinforced because you're also experiencing it and maybe not doing anything about it. So I think there's that. I do also think there's a component of I want to be like other people, and being different is a challenge for a lot of teenagers. And so, I think after the pandemic, we have all these kids that were really clinically depressed and highly, highly anxious and stressed. And it became kind of a badge of honor to wear. It's like, you're anxious, I'm anxious too. Well, let's be anxious together. Let's doom scroll together. Let's, it's a way for us to connect. And I think at the end of the day, one of the things that I heard somebody say in some addiction work I've done is one of the most profound and simple things that I've ever heard, which is the opposite of addiction is connection. And
Mm,
you think about that in the ways that people operate, and the opposite of that loneliness, the opposite of that fear is connection with like-minded people, right? So if you surround yourself with a bunch of anxious people, depressed people, or people that identify as maybe mentally ill or, their own struggles, you feel like you're a part of something.
So it sounds like a lot of what you're talking about is taking agency ultimately
Mm-hmm.
for
Mm-hmm.
what it is that's going on with you, not identifying with it, but taking agency over it instead of allowing it to control you.
Yeah.
And I love what you mentioned. You talked about the mind body disconnect, and I was just I just saw I wasn't talking to her. I saw a podcast. It's as if I'm talking to her, I guess. Dr. McGonigal talking
Oh,
about the mind body connection and what happens when you exercise, when your muscles, you
yes.
have these chemicals that are released from the muscle into the bloodstream, passes the blood-brain barrier, goes into the brain, and causes you to feel better ultimately,
Right.
which is incredible. And you can't get those chemicals in your body any other way other than in your muscles, right?
Right.
Now you can go to drugs, you could drink alcohol,
Sure.
those types of things.
Sure.
That's very
Sure.
different. But one of the best ways to get better from whatever ails you mentally, physical movement, it is that connection between the mind body. It's
Yes.
literally a physical connection between the body in the sense that when your body, chemicals are released that make you feel better. That's
Exactly.
incredible.
It's profound. And it's so that is the one area when I think about treating patients that struggle with severe anxiety and severe like thought rumination. So they're going over and over an anxious or negative thought, and especially like people who struggle with depression. Isolation is food for the beast of depression.
Yeah.
Isolation, staying and lack of movement is like food for the beast of depression. And so the one area that I get the most pushback on, that I prescribe the most
Yeah.
is movement.
Yep.
And I know that from my own personal experience. When I use myself as an example with some of my patients because I've had my own issues with food and unhealthy living as a way to cope with stress.
Yep.
And so I know what it's like from a personal experience to know that you should get up and move, but your brain is tricking you into believing that if you do that, it's not going to feel good and it's going to suck and it's going to be hurt. But I always go back to something that you taught me, and I use this with my patients all the time. So if you need me to credit you, I will.
All
But I
good.
say this, I'm like I always say that it's one of my best friends that told me this, which is the choose your suck
Mm,
mentality,
yeah.
because it sucks to
Yep.
get old and to have pain, arthralgic pain all over your body. It sucks to have neuropathy. It sucks to have diabetes. It sucks to get up at 5:30 in the morning when you want to sleep and go work out, right? It sucks to have your muscles hurt. It sucks to have to climb 40 flights of stairs, but I would much rather climb 40 flights of stairs and be able to do it physically than to look at those stairs and know that I can't even make one flight of stairs because I'm going to be out of breath and I'm going to be in so much pain that I can't do it. So you just kind of have to choose which path do you want.
Yeah.
And I get so much pushback. Oh my God.
Uh,
So much pushback
You
about
mean you don't have
moving.
a pill that can
I
take care
mean,
of
I
this?
guess I should.
We don't
I
have that
really
yet.
should.
It,
Not
it
yet.
truly is amazing that we have so much agency over this thing, over
Mm-hmm.
our brains, right? That we hijack ourselves. We allow ourselves to be
Mm-hmm.
hijacked by
Mm-hmm.
the gray matter between our ears, and
I know.
it's incredible how much pushback a professional would get by
Oh,
something as simple as prescribing movement as medicine when
yeah.
it is truly the best medicine for everything that ails us physically and
Uh-huh.
mentally. Yet
Uh-huh.
you receive so much pushback,
So
primary
much.
pushback when you
Uh-huh.
describe that.
Yep.
It's incredible to
And
me.
and it's really funny too, because I can almost tell immediately when I say it who's going to even attempt it.
Yeah, yeah,
I
that's
can
fair.
see it on their face. They're just like, no, I don't want to,
Yeah,
And so it comes back to, and I tell people this. It's funny what you said about the pill because I use that quite often with patients of mine. I'll just say, look, I know maybe coming here today, I think maybe coming here today, you might have thought that I have some magic pill that I can give to you and a word and a sentence that's going to help you feel better.
Yeah.
But that nothing like that exists. It just doesn't exist. Even if we put you on antidepressants and I went and spoke to your psychiatrist and gave all the reasons why clinically this would be helpful for you. If you're not moving and you're not eating healthy and you're not getting a good amount of hydration and you're not making choices to regulate your sleep patterns, there isn't much that can be done,
Yeah.
you know?
Well, I love that you're honest with your patients about that. That's
Mm-hmm.
huge, and I love too that you said a couple of things that were really honest today that are really important for people to consider. Um, one is what we've been talking about for the last 10 minutes. Another one is that, hey, look, the reality is that there are problems in the mental health field with certain therapists who are more concerned about their bottom line than they are the
Yeah.
outcome of patients. And
Yep.
will, whether they're doing it on purpose or not,
Sure.
consciously or subconsciously, the reality is that they are holding on to their patients for too long. They're not
Yes.
allowing their patients to, not doing the work with their patients to make them independent ultimately, to have
Right.
agency over their illness, whatever it might be.
Absolutely.
That's
It's
a that's a
something,
that's a big thing to acknowledge as a mental health worker.
yeah, I think that it would really be, um, I would be doing a disservice to this profession that I really love. And
Yeah,
if I wasn't honest about that, because I've seen it happen and seen that, there are unfortunately people who would rather keep a person sick and dependent upon them than really help them learn how to fly and
yeah.
figure it out and fall. And that's how you learn, is you got to take some steps, stumble, figure out how to pick yourself back up, regroup, and start again.
What's interesting about that too is that there are probably some patients that are really good at knowing which therapist
Oh,
is
God,
that
yes.
therapist, right? They get really good at picking their therapist and knowing who's going to hang on to them forever.
Oh, yeah. Oh, yeah. One of my colleagues here, there's only two of us in this clinic, and he and I are really close. And we laugh because sometimes he'll say to me, "So and so is going to come and see you," and the reason they're coming to see you is because I challenge them
Yeah.
on their drinking behavior and doing these things. And I think they think that you're going to be easier, and and we just laugh because I'm like,
Uh-huh.
that's going to be an interesting conversation.
Yep. Yep.
So it's fun.
So we talk a lot about breathing and meditation on
Hmm.
this podcast and in the classes
Hmm.
that I teach.
Yeah.
Where does breathing and meditation fit into your practice?
Oh man, it is. I've learned so much from you about this, and I want to thank you so much for teaching me so much about it and really opening doors to learn more.
Mm.
Um, so, meditation, I think, is something that I've constantly danced around with, I think, more so in the last 10 years. And I'd say in the last 2 to 3, it's just been so helpful for me in my own practice with stress management and with being present. I think that historically, as a student, and then just trying to get into the field and feeling like I had to do this and I have to do that, and constantly working towards a future, but also in my personal life, sometimes being stuck in the past. I wasn't in the present moment. And there was a lot of unhappiness that came out of that. And so, learning about meditation, learning how to tune in, helped me become a better clinician, not only helped me become a better person, I think, and more empathetic and more present and aware. It's helped me to do that and teach that to my patients, which has been it's just been mind blowing. And I get a lot of pushback from meditation. The moment I say meditation to some people, the first response I get is, "I can't meditate. I can't be quiet for that long."
Yeah.
And it's funny because we'll explore that, and sometimes I'll sneak in a meditation moment in a session, and then kind of teach them that what you just did was a meditative moment.
Hmm.
And then they're like, "I see what you're doing." Okay.
Uh-huh.
Okay.
Yep.
All right. Okay. And so it opens that possibility a little bit more. But breath work has been just groundbreaking, I think,
Mm,
for me in my practice,
interesting.
because I think so many First off, I think it taught me like taking your, I definitely did your meditation class and I did your 5 week breath course, which was like transformative because it taught me so many different ways to use my breath to help me in different situations, whether it's a high stress moment that I need to just get myself together and be present and ready, or it's de-stressing from a very intense thing that's just happened. A lot of times I'll use the physiological sigh breath technique or the quick 478 breath technique between patients. If I've had a patient that's come in that's extremely traumatized and unloads really, really heavy stuff and is very emotional. And then I have like 10 minutes before another patient. I have to go get somebody else and have to smile and be ready. I use those techniques to kind of help me like recenter, reprogram, regroup, and then go. And then it's helpful for me with my patients. I've seen such a huge help for patients that struggle with anxiety. Um, Mostly my patients that struggle with anxiety, the ones that struggle with depression that have sleep issues, I tend to use breath work with them to help them with relaxing at night. Because even though they're struggling with depression, what I find is that depression and anxiety are in this really interesting feedback loop where a person is depressed, they isolate, they feel alone. So they get reinforced that being alone is reinforced by the fact that they're isolating. So they don't feel like the outside world is safe and they can't go out there, which reinforces the anxiety because now I can't trust the outside world. So it's constantly feeding itself and you're stuck. You kind of, which again fuels the depression. And so at night, I find that especially a lot of my very depressed patients will have dysregulated sleep, so they either will sleep all day and they're up all night. And so they're not getting like morning sunlight and they're not getting any sort of natural nutrients that will help them with mood regulation. Because a lot of people don't realize, and this was kind of interesting news to me, that a lot of people don't realize how much vitamin D really does impact mood and, mood dysregulation. So if you're vitamin D deficient and you're not getting it from a supplement or getting out in the sun, this is why seasonal affective disorder is a thing, right? I used to work in Massachusetts. The wintertime was, it was something. People were just so depressed because you'd have a very small window of sunlight. And if you get up and go to work and it's dark and you get out at 4 and it's pitch black, you don't get to see the sun all day. Yeah, you're in the mood, and it's not a good one. So those kinds of things I think are really interesting. But with the sleep regulation, a lot of times depressed people will have a struggle at night calming their mind because they're just trying to get to sleep. And so I'll teach them, breathing techniques for relaxation.
So you mentioned the physiological sigh, just for people
Mm-hmm.
listening. The physiological sigh is a double inhale. So just think about like 80% of an inhale through the nose, and then that last 20% really pulling that in quickly. So, and then nice relaxed exhale. You can even do this in the middle of a conversation, right? The way I
Oh, I
did
do
it
it all
just
the
now is
time.
a little extreme, but
Mm-hmm.
I can do it in such a way in the middle of a conversation to calm myself down, and the other person can't even tell that I did it, right?
Exactly.
You could do the double inhale through the nose pretty quietly and then exhale through the nose instead of exhaling through the mouth and calms yourself. You're going to be skillful during that conversation. The other person has no idea that you're doing. So that's the physiological sigh. The 478 breathing you're referring to, you're talking about a 4 second inhale, 7 second hold, and second exhale. Is that correct?
Yep. Yes, that's
So
exactly
that's
right.
another a calming practice that you were referring to that as you're transitioning one client to another. So maybe you had a client that was challenging in some way, you have a 10-minute transition, and you
Mm-hmm.
use either the physiological side or the 478 both combined to get a synergistic effect
Mm-hmm.
to make sure that you're skillful as you interface with the next client.
Yes. Yeah, it's can be really challenging sometimes. I've had, I work in public health, and so oftentimes, we get everyone comes to our
Mm.
our hospital. I work in the Dallas County Hospital District, so we definitely see lots of different individuals who come in with a plethora of issues, and I may unfortunately, be the landing pad for someone's anger
Mhm.
that
Yeah.
day. I've been, yelled at, called every name in the book, threatened, you name it.
Yep.
And I'm 5'2". I'm not a very tall person,
Uh-huh.
but I have to imagine myself being 6'2" sometimes
Yeah.
in
Yeah.
order to deal with
As
people.
you're looking up at somebody.
Yes, as I'm looking up at somebody yelling at me and pointing
Uh-huh.
their finger and all this stuff, it's great. But it's taught me too how to, in that moment, be aware of my body language, be aware of how I'm breathing, if I'm holding my breath. And that's something that I think I've learned more so from like the meditation breath work that I've done with you, which has really been so eye opening. I think the holding my breath part, I didn't realize that I did it as much as I did until I took that class. And it wasn't so much like a holding of my breath because I was kind of afraid of what was coming. It was a subconscious way that I was, I think, trying to regulate my nervous system, but not knowing how to do it correctly. And
Yeah.
so I would just kind of be tight and hold my breath and not breathe appropriately. And then I was also reinforced through exercise, the way I was breathing and exercise. I would just like, would be like running and I would not breathe appropriately and then take these
Yeah.
huge gasps of air. And it was like, what am I doing? This is not working at
Yeah.
all.
Well, it's interesting because Shinzen Young talks about this formula: pain times resistance equals suffering. And when I analyze the tension in my body that would result in holding my breath, and I can still do it sometimes. I'll notice
Mm,
myself do it. What I've noticed is that most often that holding of the breath is that resistance,
hmm
right? It's the
hmm
body's natural resistance is to clamp down, to tighten. And when you
Yes.
tighten your belly, all of a sudden you're holding your breath. And so if
Right.
you just notice that tightening, the breath holding won't happen. So the
Yeah.
tightening is first, then the breath happens because of the tightening. So if
Yep.
you can become aware of the tightening as it occurs, or even right before it starts to occur, right? You notice that resistance, mental resistance to whatever it is that's coming at you, then you can keep that tightening from happening to begin with and reduce your resistance to the pain and thereby reducing suffering, which is a whole other podcast that we'll have
Exactly.
to meet and talk about again.
Yeah, and I'm glad you mentioned that because, dealing in healthcare, working in a clinic where we predominantly treat individuals with HIV, HIV is secondary on their issues of medical health. A lot of times we have patients who have been on certain HIV medications for 25 years, and a lot of these medications, especially the older ones, have these secondary effects that create other problems like severe bone density issues. And so a neuropathy, which is not related to maybe even diabetes or, impact kidney function or liver function. And so I'm getting patients that are in severe chronic pain, also depressed because they're in severe chronic pain, anxious about having to deal with whatever, or maybe they're bipolar, struggling with bipolar disorder, and they're abusing a drug that is also causing them more physical pain. And so, using these techniques to help with pain management has just been so valuable. Because, again, going through a painful procedure, if you can breathe your way through that procedure in a way that's going to be restorative and calming, you get through it without as much pain, as intensity of pain.
That's so incredible. I experienced that with my shoulder when I had shoulder surgery
Mm,
in 2020. If it wasn't for the breathing and meditation practice that I had done up to that moment, the therapy would have been completely different. The therapist indicated that I was able to complete therapy in 3 months, when
mm.
on average it takes 12 months.
Wow.
And it was because of my ability to manage the pain of the therapy itself, which was incredible. At one
Right.
point, the therapist pushing on me, he goes, at this point, usually grown men are screaming. He said, but you're not making any noises. What's going on? I said, noises are not necessary. But it was truly, I was working hard. I
Yeah.
wasn't that I wasn't experiencing pain. I was applying practices that I had practiced a lot up until that moment. That was the deal. That I had done some work on the cushion and in daily life that culminated in my ability with that particular injury to be able to manage that injury, and I was able to recover so much faster than the average person. despite my age, which is incredible. That starts
Yep.
to make breathing and meditation sound more like a superpower.
I know. I agree. And it's so funny what you say about age. I had a patient. I still have her. I don't see her as much anymore because she doesn't need me, thankfully. And she came to see me because she's in her 60s, late 60s, very kind, sweet woman from Africa, and has been here in the United States for a long time. And she had in her mind that she was too old to learn new things, and so she never sought out counseling because and it was also a cultural component too, because in her culture they would rely more on prayer or something to call in a higher power of some sort to help them through really difficult things. And so she, in her arsenal, was prayer and I guess reinforcing this belief that she was past her prime to learn something. And her physician, uh, who I'm good friends with, had said, "Look, I know you don't want to see a counselor. You don't have to see a counselor if you don't want to, but I have somebody that I want you to talk to. And if you like her, see what you think. You can't lose anything. You're not going to lose a single thing." So she agreed to meet with me. And we talked, and I won her over. She was so sweet. And I just said, "Look, we're going to go really slow, and anxiety is your issue." She had something we call white coat syndrome. So the moment the doctor walks into the room, her blood pressure would go through the roof. No matter how calm, she would take her blood pressure medication religiously. She would take it every day. She would, at home, her blood pressure was fine. The moment she came to the hospital, the moment she stepped out of the into the building, through the roof. It would
Yeah.
get so bad for her that they wouldn't let her leave the nurse's station because it would go from like it would kind of like be in the highs of like 130 something. It would go from that to 205, 235, really high in a very short period of time. And they couldn't figure out like what's going on. Do we need to add more meds? They added more meds. She started fainting. Okay, we got that's too many meds. But it
Wow.
was that when she got to the doctor's office, she would just get so panicked and afraid. So she explained to me what was going on. And I asked her, like, have you ever done any sort of breathing work or meditation? And she says, well, I breathe. And I said, well, that's good. But have you ever learned how to breathe to control your heart rate? And she didn't know that that was possible. And
Oh,
so she and I talked about it and I educated her and I did, examples and I really used myself as an example of how it's been helpful for me. And so I taught her like two or three different breathing techniques and some visualizations. And we worked through how to visualize, herself in a really calm and peaceful place. And within, I'd say, the first 3 months, by the end of that 3 months, and I saw her in 6 sessions, her her heart rate and her blood pressure had gone down significantly when she'd go to the doctor. She'd have much less instance of having to sit longer with
mm,
the nurse to
yeah.
regain a lower blood pressure. And then by 6 months, she had it down. She was so proud of herself. She's like, "Miss Jackie, you cannot believe this. I am walking. She started walking regularly because I told her use these as you walk, try to be really present in your walks. I taught her how to do a meditation walk, so a mindfulness walk where she's really just focusing on what's around her, listening. She's not in her head about all the problems of the world, her problems, things she can't solve.
So
And
you're
it
describing
just,
see, hear, feel out. So she's really
yes,
seeing and hearing and also noticing in the body what it is
yes,
that she's experiencing on that walk. Beautiful.
yep.
Yeah.
And it was just world changing for her because now I see her maybe once every 3 months because she just wants to check in and say hello and happy to do it. But she doesn't need it. I mean, she's
Yeah.
got these skills, and her doctors noticed a huge difference. She was, calling me up like, "What did you give her? What did you do?" Because this is not like I just taught her to do something that she told me she already knew how to do. She knew how to breathe.
I love your story so much. And just to add to it as another piece of data, my aunt is in her 80s and she fell
Mm,
and she broke her knee. She broke her neck in multiple places
damn.
in this fall.
Wow.
And so she was going through physical therapy. And as she was doing that, she contacted me, wanted to do some private breathing and meditation training. And I love that you talked about your patient being so proud of herself because um,
Mm-mm-mm.
aunt had the same issue where at the end of physical therapy, they would not let her leave. She would have to sit there for 15 minutes for her blood pressure and her heart rate to normalize, right? And so she starts doing these practices, and the therapists are like, well, after a minute, she's leaving her physical therapy rather than having to sit there
Mm.
for 15 minutes. And they're like, what in the world are you? She's very proud of herself, very proud of me. And she's like, well, my nephew taught me these breathing
Yeah.
practices, breathing and meditation practices. And it's incredible what the agency that you give a person when they
Hmm.
get those skills, they acquire those skills, that that sense of pride, that proudness that they experience is very real.
Oh
That's
yeah.
a very real sense of agency. It's authentic pride, it's good pride, it's great pride, right? It's the type of
Yes.
pride that you want your patients to have.
Absolutely.
Love it.
Absolutely.
Thank you so much for the conversation today, and I hope that again sometime soon.
Yes. Absolutely. It's my pleasure. Thank you for having me.
Absolutely.